Hello students, and welcome to the PICC Line special presentation. I'd like to take just a few minutes and introduce you to our patient, Miss Sarah Lynn. Hopefully some of you remember Sarah Lynn from last semester and first semester where you were introduced to her. So let me remind you of a few of the concepts in which Sarah came to class or lab or to the simulation hospital with you. As you know, Sarah is an 18-year-old female and she is from the Asian culture. Her birthday is in the month of January, for those of you who may not remember. If you remember back in your simulation experiences, Sarah developed an appendicitis and was hospitalized for a surgical procedure, an appendectomy, to take care of that. Sarah does live at home with her parents, and she does have one younger sibling. So that's some basic background information about Sarah for some of you that may not remember Sarah from last semester. A couple of other times that you were able to interact with Sarah was during a classroom where Sarah presented with some symptoms of a UTI. She was also brought into your oxygen therapy classroom. And then of course she was in your simulated learning experience as a post-appendectomy patient in a post-operative setting. So today Sarah Lynn is with us because she has a PICC line in place, and Sarah's going to be going home with this PICC line because she developed a surgical site infection after her appendectomy, and she's going to be on an antibiotic regimen for about 4 weeks, and so she's going to be going home with this PICC line in place. So what we're going to do today is focus on how to pull a blood sample from her PICC line, and then we're going to show you a proper technique for how to change the dressing. You'll hear us talking to Sarah, and then Sarah will also be interacting with the nurse who is providing care for her.
Hi Sarah, my name's Brooke and I'm your nurse. Hi, how are you feeling today? Well, good. Hopefully we've got you on the road to recovery. I've got an order to draw a complete blood count, which is some blood through your PICC line here. Would that be okay with you?
Oh yeah, that's fine. I did that yesterday too.
Okay. Let me wash my hands real quick. And I have verified my order that says that I need to draw a complete blood cell count. And I'm not going to stick you in the arm. We're just going to simply draw it from these tubes right here that are coming from your PICC line. Can you tell me your name and your date of birth?
Yes, my name is Sarah Lynn, and I was born on January 4th, 2001.
Okay. And do you have any allergies?
I don't think so. My mom's never told me I was allergic to anything.
Okay. I've already shut the door to provide us some privacy. I'm going to put my gloves on. No, this is not going to hurt at all. In fact, you're probably not going to feel it at all. But I'll tell you everything that I'm going to do. This is an alcohol swab. Let me go ahead and open my tubes real quick. For this procedure, I'm going to need 2 10 ml syringes. One of them is going to be for my waste, and one of them is going to be for my blood sample that I'm going to send to the lab. And then I'm going to have to flush out the line. Have they drew blood from your PICC line before, Sarah? Okay. Your PICC line has 3 lumens. Typically, the red lumen is designated for blood draws. So I'm going to scrub the hub for a good 15 to 20 seconds. I'm going to put my first syringe, attach my first syringe. This is going to be the waste. You want to waste blood when you're doing a blood draw because you don't want any of this blood that's in the line right now to be sent down to lab. So I unclamp and I pull back, and I should receive blood from the PICC line. Now typically you want to waste at least 5 mLs of blood. So I'm going to draw back until I get to the 5, and that's going to be my waist. Now, depending upon your facility, you may have to waste more, depending upon your policy in your specific facility. So once I get to the 5, I'm going to clamp, and that is going to be my waist. That's what I'm going to throw in the waste container. I'm going to attach my second syringe, and this is going to be the sample that I'm going to send to the lab. Sarah, are you doing okay?
Yeah, I'm okay.
I'm going to go ahead and pull back 10 mLs. Now that I've got my sample, I'm going to flush my line. And I'm just going to flush slow and steady, flushing the whole 10 mLs. Then once I get to the very end, I'm going to end in positive pressure, meaning that once I push that very last ml, while I'm pushing, I clamp the line. Unattach that syringe. Now from your 2 that you drew, the 5 ml is going to be put in the waist to waste. The 10 ml is going to be put into the designated vials, tubes, to be sent down to the laboratory to be analyzed. And that concludes the blood draw. Okay, Sarah, now that we've drawn that blood and sent it down to the lab, it's time to change the dressing on your PICC line. Is that okay? Yeah, it is kind of loose, so I think we do need to change it. So for this, I need a pair of clean gloves, an extra mask, and then a central line dressing tray. There is another mask in this tray. You do need to mask yourself as well as the patient. So I'm going to go ahead and apply my mask. I'm going to put clean gloves on, and I'm going to remove the old dressing. The dressing must be removed in the direction in which the catheter was placed. This catheter is placed this way, going up the arm. So that's the way that I'm going to place or remove this dressing. When you remove a dressing, it's important that you stabilize this part right here, because you definitely don't want to pull the PICC line out as you're removing the dressing. So the dressing comes out or comes off in the direction in which the catheter was placed, which in this instance is up. Okay, the dressing is removed. All right, Sarah, I think that's the worst part, is that dressing. When I have the dressing off, I'm going to inspect the insertion site. I'm looking for any redness, any drainage that would indicate some type of infection. To remove my gloves and wash my hands. Now I'm going to open my sterile kit. First thing on top is the mask, which I'm going to remove and put on Sarah. Sarah, I know it's going to be a little bit uncomfortable, but I'm going to put this mask over your nose and your mouth, and that's just going to keep you from getting any germs on your site, okay?
That's fine. I wouldn't want to cough on it, and I've had a little cough.
If the patient's unable to wear a mask, you do need to have them to turn their head to the other side so that they don't get any germs on the insertion site while you have this dressing off. Okay, Sarah, is that okay?
It's fine.
Okay, I'm going to go ahead and get my sterile gloves out. that in the trash. Now I'm going to set up my sterile field. I'm sterile, so I can touch anything that is in this pack. I'm sterile. Be careful when you're laying this down on the table. You don't want to contaminate your fingers. Make sure your fingers aren't underneath there. And I'm just going to transfer all of this stuff over to my sterile field. Don't get too close to your 1-inch border margin. Go ahead and open up my bio patch so that it's ready when I need it. Just throw that away. I'll go ahead and open up my alcohol swab also so that it's ready when I need it. Okay, so the priority here is to clean this insertion site. What I'm going to do first is break open my ChlorPrep. So this contains chlorhexidine. You break it open and then you kind of shake it a little bit so that the liquid comes down. In order to not contaminate your hands at this point, I'm going to take this 4x4 here and I'm going to hold it like this, and I'm going to pick up the line in this 4x4 so that I don't contaminate my gloves. Now, the goal is to clean the insertion site. Some students clean around the insertion site and never really get the insertion site good. So I'm going to start with the insertion site. So I'm going to clean the insertion site kind of vigorously up and down and back and forth for a good 30 seconds. I can get underneath the line. Just look at that insertion site and make sure you're cleaning that good, because that's the portal of entry into the patient. That's the break in the skin. Seconds there, and then you can go out. Now I want you to think about all the area that's going to be underneath that dressing. We want to make sure we clean all that area. Okay, so 30 seconds there, and then you're done. And I'm going to throw this in the trash. Okay, now if you think about it, the insertion site is clean, some part of that tube is clean, and all the area of the skin is clean. So you definitely do not want to put the tubing back down at this point, because the tubing is still dirty. To clean the tubing, I'm going to grab my alcohol swab, shimmy it off there. I'm going to clean I'm going to clean the line with this alcohol swab. Ideally, you're going to clean a new area with the alcohol swab with each pass. So I'm going up the line with one pass, and then I twist the alcohol swab and go to the side. Twist the alcohol swab to the other side. Twist the alcohol swab and go to the last side. Everything that's going to be underneath this dressing needs to be cleaned. And I'm going to toss that in the trash. Next, I need to put my bio patch on. My bio patch, what a bio patch is it is impregnated with chlorhexidine. So that white right there is all chlorhexidine, and it's tended to keep the insertion site clean in that 7 days that the patient has the dressing on. So some people, there's different ways that you can do this. If your hands are not contaminated, then you can pick the bio patch up and place that on the tube. You can pick it up like this to where it kind of opens it for you and insert it that way. The main point with the bio patch is that the blue goes up. So think blue to the sky when you're putting a bio patch on. I'm going to put it like this so that it opens, and I can come over here and slide it on my tube just like that. one other thing that you need to think about when you're doing this dressing is the line needs to set on top of that slit of the biopatch. Because when you take this dressing off, ideally when the dressing comes off, the biopatch is also going to come right off. Do not twist the biopatch around and get it stuck when you're trying to pull that dressing off. So the patient's line is going to set directly on that slit. Okay. So now it's time for me to put my dressing on. The skin is cleaned with chlorhexidine. My line is clean. My biopatch is on, and I'm going to set my tubing directly on that slit. Okay, since I haven't contaminated, I can pick up my transparent dressing. The transparent dressing, the insertion site needs to go in the middle, and your tubing is going to come out this slit right here. Press all the areas down, and then the outside piece comes off. Make sure you save that part, because that's where you're going to put your name and your date that you did the dressing. I want to make sure that everything is pressed down. This last piece is very sticky, and it's going to go up underneath the tubing. As a securement, in case that patient pulls on that line, it's going to secure that line. Okay? All right, then I'm going to remove my gloves. Sarah, is that okay?
Yeah, it feels fine.
Great, it looks great too. You're taking very good care of it. I'm going to remove this mask. I'm going to throw away my stuff, my supplies, and then I'm going to wash my hands.